everybody. It's Laura Ellen Christian with AGE-u-cate Training Institute. Welcome. We're excited for you all to join us for what will be our last webinar of the year. Cliche that I'm going to say, but it is crazy to think that we're at the end of the year already. And I feel like when November comes, which we are in it, the end of the year is just coming so quick. But we are excited. We launched our webinar series this year with a documentary connected with Hilarity for Charity called Taking Care that really looked inside the journey of families taking care of loved ones living with dementia. So we are really excited to bookend our last webinar looking at another documentary. So we're coming together to really dig into the documentary called Aging in America, Survive or Thrive. So I'm going to let all of our participants roll in. And while we do that, I am going to launch a poll. We always like to ask a question as we're waiting for everyone. So this poll is saying, what inspired you to join today's webinar? So I'm going to launch that poll as everyone is coming in. So please take a moment and answer the poll. Can you guys see the poll? Okay, I see some answers coming in. Always wondering, did I do this right? When people aren't answering, but I see some answers coming in. So thank you for participating in that poll. All right, I'll give you just a second and see how many people are going to answer. So what inspired you to join today's webinar? The answers, it's pick one or all, right? So you were interested in the documentary, you have a need for dementia education for your team, you have a desire to improve person-centered care practices, maybe you're looking for resources that promote dignity and thriving, or you're just here for some professional development. It could be one or all of those. So get your answers in, and I am going to end the poll here in 5, 4, 3, 2, 1, and I will share our results. All right. So hopefully you can see those results pop up. We're really a mixed bag. That's what I thought it was going to be. So not really a shock. So let's dig in. Thanks for coming. No matter why you're here, we are glad you're here, and we know that you'll take something great away from it. All right. So for more than a decade, AGE-u-cate Training Institute has really worked in this field to bring empathy building, evidence-informed education to caregivers, healthcare professionals, families, and communities. So many of you already know our programs. I did want to take a minute, throw up our website, and share what our programs are. So please visit AGE-u-cate's website if you are here looking for dementia education resources, or maybe something will spark through the conversation of a way AGE-u-cate can support you. But we offer a handful of education programs. Dementia Live, which is an immersive simulation that helps you really build empathy of what it might feel like to live with dementia. And it's a full suite education and training program with a lot of resources that you gain. Compassionate Touch, that's really skill building focused on elevating human connection. We have our new product called the Facilitator Dementia Education Series, which are ready to go, pre-packaged education sessions that you can deliver in person. The great thing about these is they include a video of the lived experience of a person living with dementia sharing their perspective and their skill building tips around the topics that we offer. We also have online learning courses of Foundations for Intergenerational Arts and Reveal Aging, which are 6 different topics of online learning that are also available in unlimited subscription for hosting and viewing for your organizations. All right. So welcome, check out AGE-u-cate, but we are going to jump in to our topic. And the topic connects to AGE-u-cate and how we show up for the industry, because we want to always have education and conversations that do just that, that help support caregivers and healthcare professionals that are doing the important work of caring for people living with dementia and caring for our elders in general. So I'm excited to be joined by our panel here, who are the voices, some of the experts featured in the Aging in America documentary. So we have 3 people with us today. Our 4th person, Dr. Bailey, was not able to join us today unexpectedly. So we're going to miss her, but we're going to do our best to elevate her voice here today. But with me, I have Neil Steinberg, who is the director and executive producer of the film. Neil, do you want to introduce yourself? Maybe share something with the group.
Yeah, thank you. I appreciate it. I'm a documentary filmmaker, and I've been, doing this for many, many years, and I've been working a lot in the aging field. So this project was kind of the culmination of a lot of work I've done previously.
Fantastic. Thank you for joining us. And then we have Dr. Jasmine Travers, who's an associate professor at New York University College of Nursing. So, Dr. Travers or Jasmine, you can tell us what you like to be called as you introduce everybody to yourself.
Sure, feel free to call me Jasmine. Thank you so much. Hi, everyone. I'm Jasmine Travers Altizer. I'm associate professor in the College of Nursing at NYU and a nurse by background, focused on the gerontological population, and do a lot of research focused on improving long-term care delivery for older adults, but then also closing the gap between ourselves and aging in general.
Fantastic. Thank you for being here. And then we have Amy Shaw, who is a medical director, dementia care specialist, and author. So, Amy, introduce yourself.
Hi, thank you so much for having me. I'm honored to be here. My name is Amy Shaw. I'm a physician assistant and I'm a dementia care specialist. Dementia is my passion. I serve as a medical director at 3 memory care communities in Wyoming and Illinois. And I work very closely with families to ensure the dignity and quality of life through every stage of dementia. I'm also the author of a textbook called The Arc of Conversation, a how-to guide for goals of care conversations that was just published this year. I'm very excited. And my next book, Better Dementia, will be forthcoming in 2027. I'm very excited. My work centers on helping families understand the what, when, and why of dementia so they can master the how of caregiving with confidence and compassion. Thanks.
Thank you. Congrats on your book. Thanks for being here. All right. So I also wanted to remind everybody, thanks to the support of Neil and the John A. Hartford Foundation and PBS, all of you should have received an email from us with links to view the documentary. So we will send those links again out after this webinar along with the recording of today. So please take advantage of that. We are really grateful for Neil's support and everyone's support in allowing you to have those access links. Throw some watch parties, watch the documentary again, really use this time to use it to spark innovation and action. And I know that our conversation that we'll dig into now will do that as well. So let's do that. Let's dig in. We came up with a new question that we wanted to ask to kick off this webinar just before we joined. So Neil, I'm going to ask you, share a little bit with the audience, what inspired you to create this film? I think a lot of people are wanting to know that.
So the genesis of this film actually goes back to the 1980s, where I worked with a woman named Terry Fulmer, who is she was a nurse practitioner at the time, and I had done a video with her. And I reconnected with her recently on another project. And she was at the time, she's recently retired, the head of the John E. Hartford Foundation, which is dedicated to making lives better for older adults, primarily in healthcare. And she and I started talking about, hey, maybe would the John A. Hartford want to fund a documentary? And she said, yeah. And we started talking about ideas, and I started suggesting a couple. And actually, it was Terry who came up with the idea that Dr. Robert Butler, who is a true pioneer in the field, not as many people know of him as should. And maybe we could do something about him. And then we realized it was the 50th anniversary of his landmark Pulitzer Prize-winning book, Why Survive Being Old in America. So we used that as the framework. And one of the things that we wanted to do was that there's a lot of stuff in the media and books and films and stuff about how to improve your life as you grow older. A lot of self-help type stuff. This documentary isn't about that. This is about what society has to do, what our institutions have to do, and our public policy has to do. So we felt that that was kind of ignored in the discussion. So that's how this documentary came to be. And, John A. Hartford was an incredible supportive partner on it.
Yeah, fantastic. Thank you. Thank you for sharing that background. Um, so moving on to, a little bit of, I want each of you joining us today to share a moment or story from the documentary that has stayed with you the most. So like Neil shared, it's really a documentary that's sharing a conversation, a topic that isn't touched on a lot. So from you being on the inside and being involved in the documentary, share what moment or story from the documentary has stayed with you the most, and how has it shaped the way you think about aging today? So Jasmine, I'll start with you, if that's okay.
Sure. Thank you. For me, what I was just truly inspired by and really touched me was the beginning, the opener, where we get to see more of Dr. Burke and his life and why he even pursued this work. That was really touching to me and kind of reignited, my passion for this work. But just to kind of see these issues and how deeply they were woven into our society, so many years ago, and they still continue to be issues. What really stood out to me were some things that were shared, just kind of thinking about how we're slashing our own tires, we're doing this today as well. And just thinking about today's children will one day be older people. And, that's us. Like one day we will be, the people that we are seeing who are being so negatively affected in all these different ways. So how do we change that, and when will we change that? So that really just like inspired me, and it's like, all right, like what is needed to change? But even for me, with a focus on long-term care and trying to support people in accessing very high quality nursing home care, for example, and thinking about cost and recognizing a lot of the issues that we see with the problems that are inherent within long-term care are really predicated in how we even view long-term care and aging in itself. Why we don't want to invest in these things is because we don't feel like we're going to need them. We don't see ourselves in them. So then going back, it's like we really need to change our own views on aging. So that was something that really stuck out to me. And I was like, oh, I wish I was able to have met him, but I felt like I met him through that opener. So thank you, Neil, for including that.
Yeah, thank you for sharing. Amy, what about you?
Well, every patient and caregiver family that I interact with touches me deeply. And Brenda and Michael were no exception. Their journey, as the show really well captures, is very unique. But that's the story of dementia. Every patient and family story is unique. And I think the film did a really nice job of showcasing their particular journey, but also helping viewers understand that their own experiences of the dementia journey are likely just as challenging in whatever domains they are personally experiencing those challenges. And normalizing and validating that for viewers, I think, was really important. This is a very, very difficult journey, as I think the film nicely touched on. But I also love the humanity that it captured. As I talk with my caregivers and help them understand the journey, I teach strategies to enable them to still experience love and connection. And I think Brenda and Michael were able to do that. Dementia may rob people of their skills and abilities, but it does not take away our humanity. And I think the touching moments of their love expressed in the film really capture that. And I was really honored to be asked to be part of that and for their particular journey to be captured. What a beautiful film.
Right. Yeah. It's so many stories in the documentary that are shared. And that's what I really appreciated, not just the messaging and like you said, with Robert Butler and how he started this so long ago and how gosh, we still have so much work to do. Like, where did it go wrong? Kind of messaging, and makes you go, and really think, right, of how you can contribute to something better. But what really brings it to life are the stories that were so beautifully woven through the documentary. So, Neil, what about you? I know we talked about you're, not in the healthcare field, right? Kind of, so I know everybody's loving to hear, what's staying with you from this film.
Well, a couple of things really stayed with me, and one of the stories that Amy mentioned was the Michael and Victor story. And in interviewing Michael, it was interesting. We were supposed to interview Brenda, and we talked about interviewing Michael, but we thought, we want to be respectful, and he's going through a difficult time. And during the day of the shoot, Amy came up to me and said, "Hey, you know what? Michael really wants to be interviewed." And she said, "I don't want to upset him. You don't have to use the footage, but would you please interview him?" And I was talking to Amy and Brenda about it. And we sat down and we did an over an hour interview with Michael, and he was having a good day. And it was like, I really genuinely liked the guy. He was funny. He was charming. You could see, his affection for his love for his wife. But towards the end of that interview, he got very emotional and said, "I don't want to be a burden." And that was really a moment that stuck with me for a long time. It really kind of touched a nerve. And another moment that stuck with me on a slightly different level was we went through miles of footage of Dr. Butler. He was, fortunately, he passed away a number of years ago, but he was on video a lot. And so we had dozens of hours of him. But there was one clip that we used in the healthcare section where he said, "Doctors don't make money keeping you healthy. Doctors make money when you're sick. Hospitals make money when you're sick." And it's like, how is the system broken? That in that two sentences explains everything. And I thought that was one of those aha moments. And what's really upsetting is, everyone has mentioned, was he said that 30 years ago, and we still haven't quite gotten the message. So those were two thoughts that really kind of stuck with me throughout as a result of making the film.
Yeah, thank you. And I think everybody's talked a little bit about things that we'll continue to talk about as we go through some of our other questions and topics for the panel. So our flow had Dr. Bailey, who wasn't able to be with us, kind of kicking us off with this question. So we all decided we wanted to still honor her voice in this documentary. So I'm gonna launch into the section that we were going to engage in with her. So we were going to ask Dr. Bailey. We say, the film shows how older adults often feel unheard within healthcare system. And from her practice, what changes would she make? What changes would make the biggest difference in preserving dignity and autonomy? So that was the question we were going to ask her. And I know, while we don't know everything she was going to share with us, we do know that she really wanted to focus on the 4 M's. So there is a movement of the age-friendly healthcare systems, and it's really anchored in the 4 M's. And those are what matters, medication, mentation, and mobility. And I think she would say that she sees those as the foundation of age-friendly and equitable care. And she liked how the film showcased real examples of really the what matters principle, because sometimes that's what's missing in how we are wrapping our arms around people, right? Medication, check, we've got that. But the medication in the 4 M's is like, are they on the right medications? So it's really digging into that. What matters is really a foundation of how you're then looking at the other M's or other ways that you're caring for the person. So I am going to share first. I will share because she wanted to share this image so everybody knows. Hopefully you can see that. Can everybody see the 4 M's image? Okay, fantastic. So this is what that looks like. You can Google it if you don't know. Some of you might be very, very familiar with it. But what I'm going to share next is a little clip of the documentary featuring Dr. Bailey. And what I want you to do is in the chat, and I forgot to mention, if you have questions for the panel, please put it in the Q&A. But as we're watching this about 4-minute clip of Dr. Bailey, I want you to put in the chat, how do you see her living out the 4 M's, especially the what matters? So put that in the chat as we're watching this, this piece of the documentary.
So age-friendly health systems, really a great way to say what geriatrics is and what we do and how we help people. So it has the 4 M's. It's about what matters. So what matters is one of the M's. Medications, mentation, which is helping people think better, right? Not to give medications that cause confusion, and mobility. So our House Calls program is our flagship program. It's our oldest program here at UCSF. Seeing people in their home, I think you can address a lot more issues than you can if they're just coming in for a 15-minute appointment to the outpatient clinic. It's really hard for them to get in. So they end up using the emergency department for their care instead of primary care. Care at home is also more cost effective. They've shown that 1 emergency department visit is the same cost as 10 house calls. And you'll get a lot more stuff done in those 10 house calls than you will for that 1 emergency department visit.
I think I picked geriatrics as my specialty because I really enjoy the connection I make with my patients and their loved ones. I find that for older patients, meaning matters more than just their diagnoses. And that's why I went into medicine, particularly working in the house calls. That was the point where I was like, oh yeah, this is what I was meant to do. Hi, Jenny.
How you doing?
Oh, good.
Oh, good to see you. Good to see you too. Come on in.
How you doing this morning? Good. Yeah, you look beautiful.
As always.
I was looking at the chart and I read about the wound. How's that going? How's it healing up?
I don't know. It bothers me, but like I told the doctor, I'm not cutting no more. Ain't not gonna cut on me no more. I'll die with whatever I have. I'm just gonna die with it. 'Cause I can't go through that no more. I'm too old to go through that again.
So being in the patient's home, I do feel like I have a better understanding of who they are. Is it frustrating taking this many medications, or are you okay with it?
Oh, it's okay.
I have to say the biggest thing is seeing their loved ones. That element, I think, is the one that I take home with me. What that day-to-day, minute-to-minute, hour-to-hour caretaking actually looks like.
And my eyesight's going, my hearing is going, and just.
Yeah, maybe we've talked about this, that you've outlived a lot of your
I
friends
know.
and family.
All my friends are gone, but God's keeping me here for a reason.
And I think Shanice is probably a part of the reason you're
Yes.
still here.
I don't know what I would do without her. I don't know what I would do without my granddaughter.
She's taken care of, all my life. So it's only right that I be here and I take care of her.
That's right.
Oh, you crying? Hi, maybe.
Oh, my hand. So sweet. So Mabel, it's been such a privilege to be able to come see you at home.
I know. Thank you. Thank you. Thank you. Thank you.
I do believe that the connection is a part of the therapy. The pharmaceuticals, the devices, those of course are important, but really it's the human connection, I think, that takes it from curing to healing. That's why I was called to do this work.
Hi, Dr. Bailey. It's good seeing you.
I'll see you guys before the holidays.
All right. So I think that's a lovely part of the documentary. And I was just writing down, I love how Dr. Bailey ends that clip with saying that, it's the human connection that takes something from curing to really healing someone. I think that's really beautifully put and really connects in again with those 4 M's, and the intention behind those is really connecting, having that empathy, being able to understand where that person is coming from and what really matters to them, and making that connection, because you can cure or treat the diabetes, but if you don't also take care of who the person is as a person, then you're not getting them to a healing state, right? Does anybody else on the panel want to add anything to that before we move on?
That's just very much in alignment with what I do when I care for patients with dementia and their families. My initial consultations with the family are long, 2 hours long, so that I can hear and listen to the sometimes 10+ year journey that they've been on. I can listen for the pain points, the points of confusion, where they maybe don't understand certain aspects or have struggled or have also learned lessons the hard way. And I can give them praise and normalize and validate and reassure that they've done an incredible job, as Shanice did with caring for her grandmother. You know, caregivers are walking angels on this planet, and they need to hear that they're doing a good job. And so that's definitely one of my jobs with caregivers when I engage with them.
Yeah.
Them feel listened and heard.
That's right. Yeah. And we see some of that in the chat. Someone saying that, she was really able to actually listen and acknowledge. And I know we were talking about before the webinar started that statistic that was shared at the beginning that, help me out, Neil. What did it say? One ER visit is the cost of one ER visit is equal to the cost of 10 house calls. Wow. And she was right. Think about what you can get done in 10 house calls versus the craziness and chaotic environment, sometimes that makes up an ER visit. So yeah, thank you.
Yeah. And one thing I just wanted to emphasize is just that importance both Amy is sharing and what we heard in the video of hearing the stories, asking the stories of the individual. We have partner work groups with nursing home residents, and the residents, they say, people come in to do research or to come do, to care for me, but they don't ask me my story. They don't know, they don't feel like they know them. They don't feel like they have that connection. And that's what they would appreciate. They want to feel like a person and not just a body or a disease or an illness. Ask me what do you want, what do I want to be called by, or if I have any vision or hearing impairment. So just little things like that, just to get to know the person a little bit. And even if there's some pre-work that you can do, that's also helpful. But just really bringing in that humanity when we're kind of connecting and caring for individuals.
That's right. It's the soft skills, right? And that's what AGE-u-cate as a training institute, that's what we specialize in, right? We don't offer clinical training. We are really focused on the soft skills of how can we as a aging services industry and provider, how can we elevate quality of life? And it's those connection moments that's going to do that, right? And then once you have those connections, the care that you deliver is going to be much more impactful than if you skip that important part. And sometimes it takes 2 minutes, right? Like it's not a big time investment of your day, but those 2 minutes can really equal really tremendous steps and outcomes that you can see. Yeah. Okay. So, Jasmine, we're going to transition over to you. And I know that you bring kind of a lens of the research, and I wanted to play a portion of the documentary where you're really sharing, just like we heard around, the ER visit versus the house calls. A lot of it comes down to where you live and what services you have access to. Some people don't have, like, all they have is an ER, or maybe they don't have an ER at all, right? Like, so I think you talk about this a little bit in the section of the documentary, and then we'll jump into to you. Sound good? Okay.
It's interesting how one's access to financial resources can affect their lifespan. We look at New York, for example. What we see is between downtown Manhattan and East Harlem, which is about a 20-minute subride, the life expectancy in downtown Manhattan is 85 years old. Down in East Harlem, 76 years old. A 9-year difference, which equates to 6 months difference in life expectancy between each 1 minute of that subway ride. Why is there such a difference in life expectancy? And it's the different resources that these locations have. So if we look at East Harlem, there's no coffee shops, there's no parks, there's nothing. But if I were to go downtown Manhattan, there's walkable neighborhoods. Additional things that are important with regards to one's ability to live well and age well include pharmacies to be able to access medications, to be able to access health information.
So I think that's, you know, that's just staggering statistics to think about. And it really hit me when you said, you know, it's 6 months per minute, you know, that you're getting further away from Manhattan in terms of life expectancy. So, Jasmine, when we think about that around equity, also like workforce, that has a big thing to do with it, right? Of where you're located, what workforce is available, all of that go into the research that you lead. So, what trends are most important for communities and care organizations to pay attention to right now?
Yeah, no, yeah, thanks so much for that. There are things that even beyond what I shared in that video that we don't even think about. When we think about trends, depending on, you know, what city or state you live in, there's a lot of gentrification happening in New York, for example. And how that affects older adults, especially those who are of Black race, for example, it affects the community that they had access to. So when more and more of that community is being pushed out, both in with their neighbors as well as those who are working in the shops that were right near to them, because that community is what supported their growth, their, you know, their resources. If I need something, I can rely on the community, for example. But now, as the gentrification is happening, you have less community to really rely on. So it's really, if you have family that's close to you, if not, you have very minimal resources. So that's where we see inequities as well as far as the availability of community. But then in addition, when it comes to workforce, we have already workforce shortages. People don't want to work in areas that you don't have a lot available to you. For example, you don't want to work in areas that are not safe, that are not being invested in. So that really creates disparities in just the quality of care that you're able to receive and just the actual having a sufficient workforce that's able to care for you. And then another thing is just being able to get out your house, but even be one of the things that some folks shared with us is that, you know, New York could be the best place to live as long as I'm able to get out my house. So just even thinking about the house modifications that you're privy to, or not having to rely on stairs to be able to get out of your home, which may be different from other states. And then the last thing that I'll share is which was pretty kind of sad when it came out, is we had some focus groups with older adults, and they said that when they go out, her and her friends, they wear black. And I was wondering, like, why do you wear black? And they said, because if they have to use the bathroom and they're not able to find a bathroom, then if they urinate on themselves, it's okay because people won't notice. And the issue when it comes to some places in New York City is that they close the bathrooms to people who are not customers, for example, or they don't have a lot of public bathrooms because of different reasons why they don't open their bathrooms. But that is something that is really affecting, you know, older adults and people living in certain communities because they don't have that access. And it's like, how do we actually, you know, I'm like, this is a city and state problem. This is a policy issue. We need more bathrooms available. It's not okay that, you know, someone has to feel like they have to wear all black and, you know, really, you know, kind of risk urinating themselves and actually being able to go out with friends and having experiences with that socialization. So that's just another issue that we're seeing as far as inequities. But that I'll stop there, but just a couple things to add to that, what I shared.
You know, that's a great example of while it's so important to lift up the voices of people that are living the experience, because it's not something you think of, right? It's not something that when you are getting ready to leave your house today, you're not thinking about typically, where am I going to use the bathroom if I need to use it? Like, right, planning out those things. And that gets overwhelming. And then that brings us to the isolation.
Right.
And that sometimes is the heart of what is leading to a lot of the crisis care, especially if you do live in an area, like you said, that doesn't have a support system. The other thing you shared is, when we start pushing out people's community, how again that isolates them. And I think sometimes we don't think about what is someone's community. And I think
Yeah.
about we have a Dementia Live program partner that was equipping a mechanic to be a Dementia Live coach and to have a lot of skills and resources, because for that little rural community, the mechanic shop was where everyone came to drink coffee because they didn't have a coffee shop, right? So that mechanic shop became the coffee house, and that mechanic became the social worker for all the town. So it was really important for that town to identify that they're not typically, the community isn't typically what you might think of, right, as the community. So those are great things to share. Another thing we wanted to ask you, Jasmine, is, what strategies are emerging that you think could realistically shift the aging and dementia care landscape in the next 3 to 5 years?
Yeah, no, and I'm happy for Amy to hop in on this question too. If there are any things that you have to also add, but some of the things that we've been hearing as far as technology being a significant support, specifically in nursing homes. So things like Alexa, for example, to be able to help kind of keep people autonomous as much as possible. So being able to tell Alexa to turn on the lights or turn off the lights, or even having some wearable devices or technology that can help to assess more of fall risk and alert the nursing home core to be able to let them know that there may be a risk happening, as opposed to tying people down, which was something that was often done in the past. But really, how do you understand that in real time, where people are able to kind of move around a bit more? And also that these have been shown in the home. Another thing as far as strategies that I've been hearing a lot about, which is pretty interesting, is nursing homes have created like track fields around their nursing home for patients, residents living with dementia, so that they can get up and go outside safely and walk around. Because people, they still want to go up, get up and go about and walk around and things. And someone shared with me how they had bus stops at one of their kind of tracks, so that the person said, "Oh, I want to go home. I want to go home." So they'd go and wait at the bus stop and thinking that the bus was going to come. And not to say that this is, positive or negative, but they'd be waiting there and they'd wait all day. And then, then the staff person would come out and say, "Okay, well, maybe tomorrow the bus will come." But allowing them to just actually, just be in the community as much as they could be. And then another thing, last thing I'll share is just kind of how do we engage more with the community, both whether it's senior centers, nursing homes, assisted living, adult day centers, as far as just volunteer opportunities, having students kind of engage more with people living with dementia so that they can kind of understand and be able to support that population better in ways that we're more educated, and we're hearing their stories, and we're also able to just kind of create those kind of social connections too. Is something that I would love to see more of.
Mhm, mhm. Okay, thank you for sharing. I love to see when providers are getting innovative of transitioning institutional like care settings into more of a home and a community like environment. A couple of months ago, we had the Hokovic model featured, and someone from that group Eloy that joined to talk about the innovation that they're doing of turning a nursing home, a more institutional like nursing home, into a village and a community where it even had, instead of a food services department, it was a grocery store where everyone, including people living with dementia, and their care partners, the workers, could go and shop. And that instead of like, divvying out in the storage, we need bread today or we need whatever, you go shop for what you need, in your individual home. So I love, and that's what you were talking about made me think about that a little bit too, Jasmine.
Yeah, and even they have in some homes where residents are able to take out the trash, in the kitchen, for example, do things that they used to do at home while in the nursing home, which allows people to still also maintain that kind of purpose as well.
Right, right. What matters to them. Okay. Well, our time is going about quickly. Go ahead, Amy.
I'd love to tag on to what Jasmine said. I love all those ideas. One of the really kind of sad to me policy situations is how our healthcare system is really built for provider and patient. And for that to be successful, the patient has to have intact cognition. And we know that the dementia journey is sort of like the developmental journey in reverse, that it robs us of our cortical brain mass in about the reverse order of acquisition. And so people lose their ability to become reliable historians about themselves very early in the journey. And so with my work, I've uncoupled the visit with the patient from the visit with the family. And I meet with families initially first. And this is something that I really think that the medical system really needs to embrace, because by not getting the story from the caregivers, the close spouse or other family members who are walking that journey with their loved one from day one, we are missing the diagnosis for several years, often, usually. And those are years that the patient often is coming unglued, family dynamics are challenged, financial concerns happen. There is a lot of drama that can ensue on a dementia journey if it is unrecognized. And I think our medical system needs to take responsibility for identifying this journey earlier, and enabling our providers with tools and training. Like saying that somebody's A&O times 4 does not mean they don't have dementia. But I think probably system-wide, we do not have the tools that we need to be able to engage with somebody and figure out that diagnosis. Often families struggle to get their primary care or their loved one in to see anyone. As soon as maybe the patient is diagnosed, that diagnosis is told directly to the patient, which is, in my opinion, a bad idea. Unless the patient is maybe day one and still has much of their cognition intact. I've heard from dozens and dozens of families that as soon as their loved one was told they have dementia, that person never goes back to the doctor again. They fire that physician and they doctor search until they find somebody who does not agree with that diagnosis. It really makes it hard for families. And so my passion and purpose in dementia care is to transform the diagnostic experience for families through aligning with this disease.
Mm-hmm. Yeah, so important. And I'm going to share a clip from the documentary that kind of leads us into the work that you're doing, Amy, which is, not that we're not all boots on the ground, but boots on the ground of supporting the family caregivers and walking alongside the people living with dementia through their journey as a dementia care specialist. And then also, I know you're doing that as a medical director and other roles that you're sharing. But let me share this part of the documentary because I think it's an important kind of transition into, how do we equip ourselves and our communities with resources to take care of the people that we have.
Bob Butler started, there is now a huge emphasis on finding a treatment, understanding the underlying causes of Alzheimer's disease. And this is really important and needs to continue to be supported. But sometimes in the process of all the attention and the funding that goes towards finding the cure, we forget about the process of caring for the millions of people who are experiencing this illness. So what I'd like to see is an equal amount of attention to shaping the healthcare system for better care for the people who have Alzheimer's disease and their caregivers.
So I'm going to pop over now to kind of the end of where a section where Amy is highlighted that really goes into the person living with dementia and someone that Amy actively partnered with and their family of providing care. But I think it's really profound what Michael, the person living with dementia, shares, and then how kind of Amy launches into her work.
When you think about the future, what do you think about?
People taking care of me. Being a burden. I don't want to be a burden.
Oh, you're so brave. You're so brave.
Thank you.
Oh my God.
I worry that if something happened to me, what would happen to him? And it is on my mind all the time. I don't know if this is egotistical on my part, but I don't think anybody can take care of him the way I do.
Caregivers are really the unsung hero of the dementia journey. And we really need to improve our support to caregivers so that they can maintain their own sense of well-being and purpose in life.
So, Amy, I know it gets you every time, but if you haven't watched the documentary, and again, we hope that you all will, we'll share the links out and follow up to this webinar. But Michael and his wife Brenda are someone that, a great example of a couple that Amy, dedicates her life to caring for and ensuring they have the right resources and the right support. So Michael was living with Alzheimer's and there with his wife Brenda, and Neil was sharing with us that it wasn't original that Michael was going to be interviewed as part of the documentary, but he really wanted to be part and wanted his voice to be heard, and they're all so glad that he did, and it was such a valuable contribution to this documentary. So Amy will go into, as you could see right there in that clip. And I just love the embrace and the support that you give Michael right there in the moment during that filming of the documentary. And that's definitely representative, I think, of how you were in such close connection with families, as well as professional caregivers and the people living with dementia. So what themes from the documentary do you see reflected most often in your day-to-day work? And I think you've shared about this a little bit throughout our conversation today, but what else would you like to share?
So my work is about filling in the gap for caregivers that the medical system does not provide. So we are really good as medical providers at diagnosing, identifying, and treating disease. I have a loved one in my own personal experience who I have helped get a formal diagnosis of dementia. And during 2 hours of time with the neurologist, my family and I spent all of those minutes talking about diagnosis and treatment. And none of those minutes receiving education to prepare our family for the day-to-day nitty-gritty details of the dementia journey. And that is where the journey exists for families. It's at home in, their loved one not being able to make coffee anymore, or forgetting where the spoon goes, or, putting the wrong thing down the toilet. There is so much education that the medical system does not provide to caregivers. And that education, that preparation, that understanding, the strategies for communication and support is what transforms their journey. And that is what matters to people. Like we talked about earlier in this commentary or this webinar, is that the day-to-day experience, when someone's in the hospital, they're worried about who's feeding their dog at home. That is what matters, what is happening at home. And so we really need to transform this for caregivers. And that is my personal mission with respect to dementia. And that's what I do with caregivers. When a loved one moves into one of the residences that I'm the medical director of, I spend 2 hours during a first visit capturing the whole story and then starting to provide the education and training. We follow up within a couple weeks to see how they've done. Usually, even that first hour of conversation helps bring down the stress. I can see it on their shoulders. They're breathing a little easier. They experience some hope. And then when we meet over the next months, because I meet with families monthly, I'm also sort of the on-call provider to handle any medical issues for the patient. So in our facilities, the family has a continuity between their medical provider and the patient's experience and the family's understanding of their journey. And that stays with them until the patient passes at the end of their journey, having had hospice in place. And it's really very transformative. And I think that medical systems really need to embrace this. This is a huge message in my book. My book is basically a treatise on the healthcare system and how it needs to improve itself. I didn't know about Dr. Butler's work, but it's really a continuation of identifying similar themes and saying, hey, we need to get better at this.
Mm-hmm. Yeah. So we're coming to the end of our conversation. Amy, I'll ask you this. If you could equip every caregiver with one essential skill, or maybe it's a mindset shift to help move from surviving to thriving, is what you just talked about, right? Is like the medical system now is catapulting families into survival mode when they could be taking very strategic and important steps to help people understand that they can still thrive. So if you could equip every caregiver with one essential skill or mindset shift to help them make that move, what would it be?
I teach every family member, and the reason my upcoming book and my website is called betterdementia.com is that I truly believe when we are empowered with information and what to expect and appropriate strategies that tie to the different cognitive functions that are lost along the journey, we can align our communications, our expectations, the physical and social environment with the ever-evolving cognitive skill set of a loved one with dementia. The loved one can experience relief. They're not being pushed up against their cognitive deficits, and caregivers can experience the relief. And then the entire system can experience joy and connection. And what I truly believe about this journey is that it does not have to be all doom and gloom. Actually, people with dementia, once we align all that, they thrive. They're doing great. For the most part, I'd rather have dementia than be the one caring for the one with dementia, because most people with dementia are like, la, nothing to see here. I'm good. I don't need any help, right? And Michael was a very much of an exception up until the end of his journey, and may he rest in peace. He had a lot of insight. Not everybody does have that much insight as they approach the end of their life. There are a lot of silver linings on the dementia journey, and I help caregivers embrace and understand them so that they don't have to experience this journey as all doom and gloom.
That's right. Yeah, that's right. And I think part of our work with AGE-u-cate is in offering a simulation of what it feels like to live with dementia. A lot of people, there's mixed feelings of, does that catapult people more into sympathy? But we work, and that's why it's important for us, is that we don't just provide people with the simulation, it's providing people with the tools to help you process what it feels like to live with dementia. Because if you don't feel it, if you can't get into the shoes of someone and what they're experiencing, right, their lived experience, it's really hard to then build the right skills to help them live a meaningful life. And that's what we really commit to is the experience is important, of course, but how we equip our what we call coaches with resources and the ability to help people process that experience, to bring them from the dungeon of the sympathy, right, to the plateau of the empathy. And that's where you can really ignite change and become innovative and begin those steps to move people from surviving definitely to thriving. So that's great. Okay, we've got 5 more minutes. I don't see any questions in the Q&A, but if you have them, For anyone on the panel today, please pop them in. But we do have an ending question. So I want to bring it back to the heart of the documentary and today's conversation. So we really wanted people to leave with turning insight into action. So we're going to ask our panel if viewers could take one actionable step after today. Maybe it's something that they can do in the next month, right? So it's not going to take them a year to accomplish it, but something that they could do quickly. What would you recommend to help them create a more dignified, equitable, and inclusive experience in aging? What's your one thing you want to share with people? So let's start with you, Neil.
For me, the one thing, and I'm not a healthcare professional, so I cannot speak, as Jasmine and Amy can with that expertise. But what I would suggest for me and for others is the whole idea of ageism. Ageism is so insidious in our society, and I really learned over the course of making this how subtle and yet pervasive it is through everything we do. And a real quick story, I had the opportunity to work with Dr. Butler back in the 80s when I first met, Terry Fulmer. And he told me this great story of this 92-year-old patient who came into his office and said, Doc, my left knee is killing me. So Dr. Butler examined, it was a geriatrician, examined his left knee, and he said, well, I don't want to break it, you're 92, stuff happens. And the patient said, my right knee is 92 and it's fine, fix the other one. And Dr. Butler said that was kind of a moment for him where he realized even he was guilty of ageism. And that always stuck with me. And so the idea of kind of trying to undo all of our prejudice and look at the world in a slightly fresh way, that's something I've been trying to do and would recommend to others.
Yeah, thank you. Yeah, that's something you can do right now, right? When you get off of this call and all of your work, make the conscious step to really think about are my actions contributing to that? And we do it self-consciously, right? Because we're brainwashed by commercials and everything that we see around society. So kind of break yourself apart from that. I love that suggestion, Neil. Thank you so much. What about you, Jasmine?
Yeah, I think kind of in line with what Neil shared, and I started off with this, is thinking about how how we are creating distance between ourselves and aging. So I would say just do an assessment of how you can close that distance between yourself and aging, whatever that distance may look like. So the distance that we're creating related to maybe our perceptions of aging, the things that we might say, just to ourselves or to others about aging, or, if someone's old, or if I'm growing gray hair, or the things like whatever it is in negative ways. Where are the opportunities for us to kind of take that away? Or even, I'll wait, I don't need to eat healthy now, or I don't need to do physical things now because it doesn't matter now, because it actually does. So just do an assessment on the ways that you're closing, or that you're creating more distance between yourself and aging, and what can you do right now to close that distance?
I feel like you were just talking right to me, Jasmine. I find myself, in my mid-40s, and I'm like, oh no. I need to do all the things that I've taught people to do my whole life, right? Like I'm in it. Now I've got to take my own advice. Thank you. I love that. All right, Amy, you can close this up. What's your advice?
I really love what Neil said, and I 100% agree with that. I also want to add the other facet to aging, which is that dementia is a real experience for our aging population. It's very prevalent, and it's even more common as we get older. And so I do encourage, if there are providers of any sort, to look at your business model or your healthcare delivery model and see how is it that you are delivering care to the patient, and if you are or if you are not, including the caregivers, to find a way to do that and to do it separately so that you can still preserve people's cognition, especially if you know that there is a dementia component. And if you're a system like an ER or a hospital, starting to think about Making cognitive screening assessments part of the standard of care for older adults so that we don't miss a diagnosis of dementia over time. We talked about medications, the 4Ms. People misappropriately taking meds is a big risk for them at home, and we need to really take care of our older folks in our community because, like Jasmine said, we're going to be there at some point too. Thanks.
Well, guys, thank y'all so much for this great conversation. We're getting a lot of comments in the chat about how insightful and helpful it is. So like I shared, we'll send this recording out to everybody. And my action is to watch this recording, maybe have a watch party with this recording, but definitely have a watch party with the documentary. You're going to have the link to access the documentary complimentary streaming until next Wednesday. So watch it again. I just went back and watched it again this week preparing for this webinar, and there are things that you're going to take away from it differently. So I think just gather people and have a conversation just like we've had a conversation today. And that is where innovation sparks, right? Of how you and your team's grassroots efforts, whatever organization or community you're connected with, figure out, be inspired by the action that has been talked about today, and then continue to inspire yourself by leaning into these conversations. So thank you so much for joining. Neil, Amy, Jasmine, we are so grateful for first, the incredible work that you're doing out there every single day to help America move, right, from surviving to thriving, and then very grateful for you giving up your time to be part of this conversation with AGE-u-cate today. So thank you so much. We hope to connect with you somewhere along the way. Take care.
Thank you. It was great being here.
Yeah, what an honor. Bye.